Welcome to BW Healthcare World's Thursday Thought Leaders with Harvinder Narula. My guest today is Dr. Sathya Sriram, someone who's steering the ship as a CEO of Preventive Health at Apollo. She is reputed for her dynamic leadership and unwavering dedication to preventive care that pivots, shaping the future of health and well-being. She derives transformative initiatives that resonate with Apollo's commitment to excellence and patient care. So let's welcome her to our weekly show, Thursday Thought Leaders on BW Healthcare World. Welcome, Dr. Sathya Sriram, to BW Healthcare World's Thursday Thought Leaders. You have a diverse background. You've not just been in healthcare, you've been in different domains. Now, how has the state of preventive health in India changed in your perspective, not just looking at the healthcare industry per se? Do you think that we have seen an increased relevance of preventive healthcare post-COVID? Has the mindset of people changed? Have they become more receptive to taking care of themselves and focus towards prevention rather than reactive healthcare?
Firstly, Harvinder, thank you so much for having me on the show. I am absolutely delighted and privileged that we are increasing the dialogue on preventive health in the country. Thank you for spearheading that. To answer your question, I think there are multiple trends that are happening in the country that are first setting the stage for preventive health becoming a priority. The first is that the life expectancy of people in general has been increasing. The average life expectancy was about 40 or so in the 1940s and 50s. Now it is about 70 years old. And therefore, overall, life expectancy is increasing. Second, the population in India is also beginning to age. About 10 years ago, we had a lot of discussions around the demographic dividend and how that's going to become sort of the pillar on which India's economic growth is built. That said, that population is aging. So roughly now, I think about 10% of our population is greater than 60 years old. By 2050, that 10% is going to double. So about 20% and almost 350 million plus people are going to be greater than 60 years old. The third trend is that non-communicable diseases, diabetes, hypertension, cancers, more recently mental health, all of these are on the rise. Back in 1990, roughly about 25% of the deaths in the country were due to NCDs, non-communicable diseases. Today, about 65 to 70% of the deaths in the country are because of NCDs. So the percentage, of deaths due to these preventable lifestyle-driven diseases has increased dramatically. As a result, we should be thinking much, much, much more about preventive health. Add to that the most recent phenomenon around the awareness due to the pandemic. What we realized as the result of the pandemic was that every one of us is different. Every one of our bodies is different. I think we all knew that at some level, but I think the true appreciation of what that meant came during the pandemic when no two people reacted the same, whether it was to a vaccine or to the infection itself, within the same household, within multiple generations, amongst friends. The second realization that came about was that each of us actually tends to respond differently because of also these comorbidities, So people who had diabetes, people who had hypertension, the way they responded was actually far scarier to the infection than others who didn't. And therefore, the awareness to be able to take care of their health more, be much more conscious of the preventable diseases went up. All of this said, even though the stage is set, the trends are there, the awareness is there, I think the biggest thing that has to shift is the consumer's own mindset. The problem with preventive health is it is not at all tangible. What is going on inside your body, inside your brain, inside your heart vessels is not apparent to us. It will only become apparent too late. And therefore, because it's not tangible, we can't see it, we can't feel it, we can't truly understand what it is, we tend to put it off. And we tend to say, Arey, kuch nahi hai, we'll take care of it another time, right? Or we postpone it. And I think that that is the biggest challenge that we all have to overcome.
That's so true. I mean, it's important for us to understand where the nation is headed, to focus on what is important to us at this stage in healthcare. Now, when we recognize these kind of challenges that need to be taken care of, how are institutions like yours and similar organizations making preventive healthcare accessible for all? And when I'm talking about all, is it includes the rural and remote areas as well, because these have been ignored for a while. Even though we are making efforts, there's still a long way to go.
Absolutely. And I think that much of what we do has to percolate throughout the country, right? And I think that that's the primary objective. Let me tell you a little bit of a small story of where at least my own inspiration to transform and evolve the health check program that Apollo does today, called Pro Health, where that came from. It actually came from the villages and the district of Aragunda and Chittur. And our chairman hails from that district. And so he wanted to give back to that community in Aragunda of Andhra Pradesh. One of the things that he knew best was, given he knew healthcare very well and is very passionate about preventive health, he started a program to screen people on the ground there. So roughly about 65,000 people in the district of Aragunda, right, in the villages surrounding that the village he came from, went through a screening program. They were then risk stratified to be determining who actually needs more care, who is actually healthy and it's okay, but we need to watch for signs in the future. And they developed a follow-up care program that was set up from the primary care center in that village. Subsequently, we now have 4 or 5 years of data to show that about 85% of those who had hypertension are now managed, which means it's well under control because they're taking care of their lifestyle and medications included. Diabetes, about again 82 to 85% are well managed. The early detection cancers, roughly about I think 12, 15 people were diagnosed with cancers. They were all taken care of and have been cancer-free since. This program called Total Health gave birth to Pro Health, because we said if we can do this in a community, in the villages of Aragunda, then can we not do it in our hospitals in the urban areas? So the inspiration for what we do today across Apollo came from Total Health in this community. We are now working with other companies to take this model to other rural clusters around the country. And we are able to therefore demonstrate over a period of time, because this change is not overnight, right? But over a period of time, that habit changes will stick and the community overall will get healthier. The other example I want to share is through the Apollo Telehealth services, we actively partner with the government and take preventive health screenings out to rural areas and much more remote areas. So whether it's a pap smear screening or at scale, or even an eye screening at scale, right? Multiple kinds of screenings at scale. We work with many governments and take them to the remote areas so that we're at least able to highlight to those who need the care that they get it as early as possible.
So, Dr. Sriram, we are a nation with a very high population. And being in healthcare, I know that, we've been having this conversation for decades that there aren't enough beds available for the patients. So we have large number of patients, but we also have a challenge of the lack of number of trained experienced doctors in the country. Do you think that preventive healthcare has helped or could help reduce the burden on the doctors and the medical professionals? Because, I mean, if you compare the doctors working in the West versus the doctors that are working in India, there the doctors are working from morning till about 5 in the evening. Here, the doctors do not have enough time to spend with their family. So there's a burnout which is happening. So, how do you think the preventive healthcare or the focus on this could reduce the burden on the healthcare system, reduce the burden on the doctors, and reduce the burnout that the healthcare industry professionals are experiencing?
Harvinder, I think the realization of that being a reality in this country came during wave 2 of the pandemic, when we were literally, right, short-staffed, short-bedded on equipment, on medicines across the country. And I strongly believe that if we continue on the same trajectory of NCDs that we are on as a country today, we will never have enough beds, enough medical professionals to be able to take care of this country. Therefore, preventive health is our only solution. The more each individual realizes it, each community realizes it, each state realizes it, the better it is for all of us. It reduces the burden largely because of early detection and proactive management. Allows you to ensure you do not end up in the ICU, in the inpatient care, and our hospital setups are truly set aside for those who need it in those dire times. We are doing ourselves a service, we're doing our families a service, and we are doing our country a service when we start to take care of ourselves. And definitely, in addition to this lesser burden on the system, because you will be hospitalized less, the other thing that we are investing some time on is building tools, leveraging technology to be able to help the doctors ease, right, sort of their own burden in terms of quicker diagnosis through AI tools, helping them risk stratify. The minute we can tell them and help them risk stratify, we are able to therefore give them some tools in hand to very quickly make decisions. For example, we have a cardiac risk score. Now, the low risk and the high risk are easily picked up. Right? The low risk, we're like, great, healthy, keep at it, come back in a few years. High risk, we're like, oh my goodness, really need to take care of things now or actually yesterday. So get going. And in some cases may require immediate procedures or hospitalization. The bucket actually I worry most about is the moderate and the medium. Here is the group that we can actually make a difference. And that group is growing by the day, gets missed out because they're neither healthy, right, nor shipped off for immediate hospitalization or procedures, but have a very, very high tendency to move in the wrong direction if they don't get the right advice. And so, in my opinion, the risk stratification actually helps identify this bucket of people and helps us communicate differently for that group, and makes it a additional, right, easy tool for the doctors to start to use. We have another AI tool that we have built based on multiple outputs that our system across the country has around symptoms and checking symptoms. Today, we are all guilty of checking our system or our symptoms with Google Doctor. We're all guilty of it. I don't know a single person that hasn't checked a symptom on Google. Worse, I think, is the WhatsApp University. The reality is neither of these folks went to medical school. Neither of them are reading scientific papers and updating themselves. And neither of them, right, are actually putting together the many things that are possibly going on in your body. Remember, our body is a complex system. It's a system of many different parts. Sleep impacts our gut, impacts our brain. We don't think about these things in cohesion, and Google is not yet smart enough to do that as well. Our AI engine is now able to bring together multiple symptoms, different parts of the body, what's going on, and then ask you many questions to narrow down a set of possibilities. And even then, doesn't presume to know the answer. Says, here are possible options, check with the doctor, because let's be honest, that's actually the person who is the trained the most. And so the easier we make it for that person, the better off we will be as a country.
So, Dr. Sriram, incidentally, I got into healthcare because I wanted to solve this problem of the Dr. Google thing. And in fact, it was funny because I was working at Google at that time, and I quit Google to get into healthcare. But since you're talking of technology, Dr. Sriram, we also understand that one of the biggest push that we get towards prevention is predictability, right? If we are able to predict, that is when we'll be able to do something about what we are headed towards. And you were talking of technology. What are some of the other disruptions that we have seen in the field of preventive healthcare in the past few years that have brought in ease of predictability so that we can do something about it?
Yes, I think you're absolutely right. Predictability allows us a little window and peek into the future, and therefore, right, makes it a little bit more tangible for us to take actionable steps today. That's how we should use the predictability of some of the tools that we are developing and have been developing for preventive health. Let me give you a couple of examples that I'm actually most excited about. The cardiac risk score that I just described a few minutes ago was a collaboration with Microsoft. And we jointly looked at the longitudinal data of multiple Indians who went through some sort of tests and then over time ended up in a cardiac event emergency situation. We looked at that data and then broke down the different elements that contributed towards the path that this person was on. It is genetics, so family history. It is the lifestyle choices that an individual makes. It's also a factor of age and gender. Some of these we don't have much control on. Genetics is what it is. We've inherited some of the good, some of the bad. Age and gender, it is what it is. The things we have control over are the lifestyle factors. The reality is your risk score is going to be different from my risk score purely by function of the unmodifiable risk factors as well, right? Now layer on top of that the choices that you and I are making. And essentially, then our risk scores are even wider apart. We've modeled this piece out and this complexity for the Indian population. And the reason I'm saying the Indian population is we've known for a while now that the cardiovascular predisposition of the Indians is very different from the Caucasians. And so using a common tool like Framingham score, which is very popular, is a Caucasian-built tool. We've now taken the learnings from our own work and developed an indigenous proprietary tool for the Indian population that says these are the combination of factors that actually matter for us in India. We're doing the same thing now for diabetes. If I can tell you that you are on the path to getting diabetes, not yet have, on the path to getting diabetes, then hopefully we can truly reverse, right, your condition, because you're not going to even get there. You can actually reverse what's going on inside your body much more easily than if you actually diagnosed itself. We're doing this for liver fibrosis. Many a time, at least for many years, and I was growing up, the minute we hear the word liver fibrosis, liver transplant, we think alcoholism. That is no longer the case. Our hepatologists, for every liver transplant due to alcoholism, they're doing one liver transplant due to excess carbohydrates. Right? So this is now a non-communicable disease, fatty liver, which can be diagnosed early and taken care of. But we're losing sight of it because we don't get ourselves tested. It's not tangible until it becomes a problem and we're too far gone. So we're extending the tool to liver fibrosis. We're now looking at chest x-rays, right? Both from a tuberculosis point of view, but also from lung cancers and so forth. And so we're growing the number of tools we have for prediction to be able to help people then say, listen, you may be on the path. Please find a way to actually shift that path, because that is in your hands. The modifiable risk factors, the lifestyle choices that you're making are what you can do something about.
I completely resonate with what you just said, because, we traditionally have been responding to symptoms,
Yes.
And we have not focused on getting ourselves tested to prevent that anything could be coming in because of our age, or the kind of environment that we are growing in terms of lifestyle. So I think that is extremely important. Another aspect, Dr. Sriram, that comes to my mind is that when we're looking at our education system, our medical education system, even when we look at surgeries, we are training them on traditional methods, whereas when they actually come and start working in the hospital environment, they may be using or may be expected to use robotics, etc., for which they have not been trained, which is why the training has been now being provided by the manufacturers. Similarly, when we look at the prevention, I don't think our education system, the medical education system, has been training our doctors to go out and spread the word or focus on people or their patients around the prevention. I've also heard a doctor saying कि यार जब होगा तब देखी जाएगी, अभी enjoy करो, chill मारो, ठीक है ना? So do you think that something needs to happen in our medical education systems to create a culture of preventive healthcare? And should there be a standalone or a significant part of the curriculum?
Absolutely. Absolutely. I think that we need to have a super specialization in lifestyle medicine, in community medicine that exists, but not enough people pick it up, right? Going back to your earlier point around rural and remote communities. The challenge is the medical curriculum today focuses again on the physiology of the body and what's happening and how to manage conditions, especially so when they are critical. The number of people that come and see the doctor when there is a pain here, dard here, is too high. And therefore, they are trained for that purpose. When I again go back to when the consumers, and I don't call them patients because they're not patients yet, when the consumers start to ask more about prevention, when they ask questions around how do I not come back to you again, that is when I feel people will take this seriously. And that's why I call it a super specialization, because we can't wait for the entire medical system to change. We can, though, offer certifications, diplomas around lifestyle medicine that bring in the new science that the world is finding, adapting that to the Indian population context and the Indian environments, and then being able to practice that medicine. I think this is a dire need. In addition to the doctors, I think the allied professionals in health for lifestyle medicine are far more important as well. We should save the doctor's seats for the tough, critical situations that only they can handle as well. However, how do we truly expand the allied health professionals, give them the training that is holistic, that is science-backed, evidence-backed, truly help them bring the medicine, science, technology along with empathy to be able to help people make the changes that they need to make. And so I strongly believe this combination of in the ICU, it may be the doctor and the nurse, But for preventive health, it's the doctor and the lifestyle medicine expert that needs to come together.
And I think, you also need lifestyle specialists to go out and create awareness at a very early level. For example, I mean, I've seen the only one area in healthcare or medical medicine that has actually gone out and proactively spread the message of preventive is dental. I mean, they go to the schools and tell how do you brush your teeth, how do you ensure that you don't have cavities. I think that is something, that level is where the prevention specialists need to go and educate people that listen, if you eat this, this is what's going to happen. If you don't go in for sports, you might end up in a particular situation. Now, Dr. Sriram, another area that I really want to speak to you about is, you know, talking about the mindset of the patient, talking about the education of the doctors is one aspect. Nothing turns reality until the ecosystem develops, you know. And while we are talking about healthcare being a very noble profession, etc., every healthcare institution needs to sustain itself and create a financial viability to be able to serve the population. How big do you think is the prevention uh, domain within healthcare to make it meaningful for institutions to start focusing on it, creating that specialty within the hospital environment? Uh, how big is the addressable market?
Yeah, I actually think it's very large, right? And the reason I think so is the following. First is when it comes to preventive health checks, I don't buy that blood tests are sufficient.
Mhm.
It is only a part of the story. Unfortunately, it is the cheapest part of the story
Right.
and therefore tends to be done the most.
Mhm.
However, many things cannot be picked up early. And therefore, you need the blood test complemented by the right set of imaging. An ultrasound can detect 20 different conditions, including cancers in the abdominal region. So even if it means waiting to be able to get that ultrasound, let's get that done. Having a treadmill stress test or an echo and an ECG is absolutely required to ensure you know the state of your heart health. Otherwise, there's nothing in the blood marker until it's much too late to tell you what's going on with your heart. Similarly, your lungs, post COVID, a number of people still suffer from long COVID. And so, how do we ensure that the X rays and low dose CT is used? Now, these imaging equipment are a one time capex that you install. And then the operating expenditure of that is actually very low. So, the more we can use that during the downtimes in the hospital environment for preventive screenings, the better it is, right? So, for example, we try and schedule our radiology for health checks pre 10 or 11 a.m. and post 4 p.m. because the peak usage for the hospital IP and OP is in this 11 to 4 p.m. But outside those hours, that capex is installed and can be utilized for these purposes. So this is a small example of how a hospital can truly ensure financial viability of the preventive health vertical if they start thinking about all the assets that they have at their disposal. I also think hospitals are only one part of the story. Outpatient centers, clinics, primary care centers are a big part of the story. And they don't take much capex to set up. Very different from a full-blown hospital. How do we find, and the reason I say they are a big part of the story is because they're very close to our communities. We actually don't think twice about walking into a small clinic or a primary care center, but we will think 100 times, especially post-COVID now, about walking into a hospital. And therefore, these small clinics, whether it's inside your RWA in society or down the street, right, in the community, tend to be the first point of contact for many of us. And we're very comfortable with that. So how do we find a way to ensure that they are set up with the absolute minimum equipment to be able to do this at scale and reach as many people as we possibly can.
It's absolutely, I can see the importance of having a non-medico, somebody with a McKinsey background coming and handling this particular area. Uh, Another area that I think, what we need to focus on is trying to set up primary health checkup centers which are focused on preventive. Do you think that could be a reality coming forward? Because most of the diagnostic chains that I see are also, people are going there only because they're responding to some symptom that they have seen. And it's more like people are going into a center where they find everybody is sick around themselves, right? But do you think that India now deserves to have specific primary screening centers which are just focused on prevention?
Yes, and I'm actually very excited for the community health and wellness centers that the government has been setting up across the country. I think they are very, very well positioned to be able to do this. And it's getting set up across all parts, right, of the country. In addition, I do think that the private sector should get into also setting these up. It's always helpful to have that healthy competition in the market to ensure that we are delivering the best and bringing the best to the people.
And what are some of the trends that you have seen in 2023, which are very encouraging and you feel are going to be really impactful in creating focus on preventive healthcare in 2024?
There are a few, let me break this up into at least two different buckets, right? One is the expansion of the definition of preventive health. I'm most excited about that. I think we're starting to see inroads. What I mean by that is, it's not just always about testing your blood sugar or measuring your BP anymore. It is about how well you sleep. It is about your flexibility. Are you able to bend and touch your toes without bending your knees comfortably? It's about correlating what's going on in your gut with your daily routines and seeing how that is impacting your function. So our definition itself of preventive health, I'm starting to see expand. And people are seeking the connections between these kinds of actually lifestyle habits and what's going on inside their body. And we are able to actually introduce, therefore, specific parameters, specific, very simple tests that allow us to make a determination of, again, the path that you're on well before you get there. And this is now way, way more expansive than just the blood sugar and the blood pressure. The second piece is the technology that is coming into the market in order to help with some of the predictions or early detection. Two such technologies come to mind. The first one is a whole body MRI. So MRIs typically tend to be used largely in an orthopedic situation and to focus on a particular part for the surgeon to actually determine what kind of surgery or course of action that they want to take. We've now seen that many parts of the world are moving to using the whole body MRI, a full quick scan to determine whether there are growths, cancers potentially, aneurysms that one has to be taken care of. This is actually a fabulous technology because it is no radiation whatsoever. And therefore, you can do it and not worry about the radiation effects that a PET CT has or a CT has. We are starting to do this across the country and seeing a lot of uptake, especially for those who have lots of family members getting detected with cancers and are worried about this. Whole body MRI picks up the cancers much earlier than any other technology. The other one that's actually very exciting and interesting is genome sequencing. And the jury is out there on that one. I'm excited to see what's going to come there. We are starting to see much more interest in people wanting to sequence their genome and understand whether they have a predisposition for something or not. Remember that this is tricky business because it doesn't guarantee, right, any outcome. However, it helps you determine whether you should be screening yourself much earlier, more regularly. It also determines certain lifestyle shifts that you can do. It also sometimes is fun. So for example, I learned that cutting out carbs in my diet isn't really going to help me lose weight. It's in my genetics. And so I have to find other ways to lose my weight and actually do more physical exercise than just simply cutting out carbs in my diet, right? So it also helps make those kinds of determinations in how you want to actually change your lifestyles. So there is a lot more work to be done. And the reason I say the jury is out there is because our population is different, our environment is different. And so the genome sequences, right, are going to have to be compared with our population's genome sequences, not the West. The epigenetics that is now starting to come in play, again, is a function of our environment. And we don't have enough science yet to be able to tell us how our population is different and impacted. But I'm very excited to see how that technology is also going to impact preventive health and how we think about our own lifestyles in the future.
Dr. Sriram, we've spoken about technology and how it is impacting. My last question to you about the business, before I come to two questions I have about you, is that, how is Apollo Preventive Healthcare working on creating a preventive health mindset from a curative health mindset?
Yeah. So the primary way we are trying to achieve that is by putting out our evolved version of the health check into the market. We call it Pro Health. The name itself suggests that you should be proactive about your health. Be Pro Health. We have incorporated into Pro Health a number of things that we believe is important for someone to actually change their mindset. The first is every one of us is different. Our bodies are different. Therefore, the tests you require is also different based on your genetics, your lifestyle choices. I may need some tests differently from you. So why should we all go sign up for the same standard package and then also have a doubt on whether more testing kiya to more they'll find something on the other and therefore I won't do it at all. We actually have developed an engine for personalization. So we can tell you based on answering simply 10 questions, what you should be tested for. Nothing more, nothing less. Let's first see. Now, if there's something that comes up in that, then we will see the next level, right, of what is required. But personalization is the first one. So we're not trying to con you in any way. We are trying to be focused on you and what you need. The second piece is we talked about prediction and predictive risk scores. So a number of these scores that we're developing are now integrated into our Pro Health, which then allows us to say, even if you're not in a red zone today, your path is taking you towards a red zone. Let's actually do something about it now. So you shift that path. That to me is shifting the mindset towards more proactive and preventive measures. The third piece is we all need support every now and then. We will all get off track when work gets too much, family pressures pick up, right? It's bound to happen to every one of us. We have a health coach, a health mentor, follow up, and simply nudging you with digital messages, and if required, based on your severity, a set of phone calls to help you take charge of your own health. So the whole premise of Pro Health is for you to be proactive, because ultimately the decision to make that change is in your hands.
Got it. And Dr. Sriram, now coming on to you. How do you think that your background, I mean, I was talking to you earlier and you shared with me your experience with media, your experience with McKinsey, and your study in healthcare itself, how does it all come together and help you do a better job of making a difference to create this culture of preventive healthcare?
So the way I see it, right, this entire space has three broad stakeholders. The first is the doctors and the health professionals. The second is the uh, I'm going to call it the healthcare system, right? And this could be business, it could be governments, right? Depending on who is actually funding that system. The third is the consumer. Let me talk a little bit about how, over the years, I've been able to pick up and bring the experiences through various through my life journey, to address the mindsets of each of these three stakeholders. So my science background in medicine allows me to actually bring a clinical perspective and a scientific perspective when I talk to the doctors, speak to them with research papers, speak to them with some credibility, and also work with them and understand what they have in mind to be able to actually collaboratively come up with new solutions. With the business and the government stakeholders, my experience with both the nonprofit sector at McKinsey, as well as my many years at McKinsey, has allowed me to sort of bring in and ensure that there is a viability, a sustainability, the ability to take an idea and put it into action. All of this constitutes essentially good business hands. And the last piece is the consumer. I think I owe all of that experience to my time in media, because you have to learn to understand the consumer when you're working in media. I headed marketing there, and so putting them at the very center, constantly looking at whatever we're doing is from their perspective and their need. And I think for me, more than anything else, this role allows me to bring all of these experiences to be able to do justice to a vision that I think is way beyond all of us.
Yeah. Dr. Sriram, when we're talking about the business aspect, I think, one area that can be really impactful in making a difference today in prevention is insurance. Because, insurance does not recognize preventive tests and does not fund it. And whereas that is something that is going to be, that personally I feel is going to be really good for their business if they have less number of claims coming in. And if they were to proactively go tell people to go get their test done, we'll pay for it. That's one area I think all of us need to come in and build this collaboration to make that happen. Last question for you is that what is it that you personally are passionate about? What is your hobby? What is your passion? And do you get time to pursue that? If yes, how do you manage it? And the reason I'm asking you this is because when I'm thinking to women business leaders, they have, I mean, all kinds of responsibilities, and even if not physically present, but their mind is at all places. So, which is why I'm asking you this.
Absolutely. So I think if I don't live the pro health life, I have no business talking about it. And so I try and find a way to make time for myself and the community that I live in. So I am a mother of two wonderful teenagers. So that says it all. They do draw on my time, and have the privilege of living close to parents and my husband's parents. And so they draw on my time as well. That said, I love cooking. It is my stress buster. I would, do anything. If I've had a rough day, I walk into the kitchen and I let my creative juices flow, and whip up something that I'm very excited about. I dance. And so it helps me be physically fitter than simply my morning walks and my yoga. So in addition to that, I try and dance. I'm deeply passionate about it. I've always wanted to learn. I finally started learning as an adult. And so my Bharatanatyam classes are sacred on Sundays. And finally, I am very passionate about other women leaders. And so I do some pro bono work whenever I can to do workshops and leadership development for women in all walks of life, whether they are teachers in our schools or women in college at IIT Madras, or women in business. I find a way to make sure that I'm able to carve out time to share my own experiences with them and help them chart out their path, so that more and more women stay in the workforce and continue to inspire the communities that they live in.
Awesome. Dr. Sriram, thank you so much for taking our time to speak with us today. Understanding that or realizing that the life expectancy is increasing, and thanks to the development or advancement that we have seen in the healthcare and managing the healthcare, we are fortunate that we are living at times where people could expect to live little longer. But then aging, and you said India is an aging population, and aging brings its own challenges alongside, because when you are living longer, you are expected to face certain health challenges, and which is why what you spoke of, that the mindset of prevention and proactive health is something that we need to work on besides the advancement in the healthcare per se. And coming, so that's a very important aspect that I saw coming out from this conversation. And second is from the business aspect, it is a realization, or must be a realization for hospitals, that if you have equipment already there in the hospital, use the existing equipment on their downtimes, or when they are not being utilized, to start focusing on creating that culture of preventive healthcare for the people who walk through the doors of their hospital or their clinic. And I think that's a small change or a small difference that these institutions can make to the population that they are serving. So those are the two things that really came out very, very strongly from this conversation. I really thank you for taking out time to speak with us at BW Healthcare World.
Thank you so much for having me, Harbinder. It's been truly a pleasure, and may we all be more pro-health.
Absolutely.
Thank you. Bye-bye.